Okay, so we're going to continue, and as you can see, my board we went over the pneumonia, we went over the flu, we went over the rhinitis, and we even went over some of the medications. So I'm going to erase everything that we've gone over so far. Now, if you look at the board, we have a few things left over. We have this category of medications: antitussives, expectorants, mucolytics, antihistamines. These are all your upper respiratory infection medications. And so if you turn the next page after the cold and the flu, you'll see the section that talks about antitussives, expectorants, and mucolytics. I want you, for the antitussives, I want you to remember that that is going to look exactly like that on most tests that you would ever take in school or for NCLEX. It will use this word, antitussives, and you have to remember this is a cough suppressant. That's all it is. It's a cough suppressant. Many times the cough suppressant is actually an opioid, so I'm going to give you a couple of those to write down. One of the antitussives is hydrocodone, and this is basically Vicodin. Another one is codeine. Another one, which I'm positive you would know what I mean when I write it, so I really want you to write it in your paper, is benzonatate. Benzonatate, okay? What the hell is that? Well, it's Tessalon pearls, and a lot of patients love them. They didn't do shit for me, but they work for some of our patients. So I had this so-called upper respiratory infection where I had this cough and it wouldn't let go. It was bad, it was getting worse by the minute and by the day, and I went to the emergency room thinking maybe it's not just a simple cough and cold, maybe it's freaking pneumonia. I don't want to blow that off, let me get my butt to the ER. I get to the ER, I see a nurse practitioner. She goes, okay, we're going to give you some Tessalon pearls, see how that works for you. And I took the Tessalon pearls, didn't do anything for me. A lot of people love them. I've had patients that do really well with them and do shit for me. So a day and a half later, I'm like, okay, this is really bad. It's getting worse. It's not getting better. It probably is pneumonia right now. It wasn't pneumonia yesterday, but maybe it's pneumonia now. So I went back to the same old ER. And she goes, oh no, you're back. Well, the good news is you don't have any crackles in your lungs and you don't have any, fever, which would be pneumonia. So we're going to send you home with a cough suppressant, but this time we're going to give you hydrocodone. And I was like, okay. And, in my mind, I'm like, oh, wow, this is serious shit. This is Vicodin, right? So she didn't mention anything about side effects or any of that crap. So I took this Vicodin pill. Lord have mercy. Let me just share with you, just so you can be empathetic with your patient, and maybe somebody I'm talking to knows that this is true for themselves. I can honestly say that before that day that I took that damn Vicodin, I had really not a lot of understanding and probably almost zero sympathy for people that were like addicted to pills and shit. So I was like, yeah, right, you're addicted to pills, that's crazy. It's like not heroin, you're shooting up heroin. No, it's just pills, just stop the pills, right? No. I took that one Vicodin pill. I was like, okay, this is great. I felt better than I've ever felt my entire life. I could have conquered the world. I cleaned the entire house. I was ready to cook a whole Thanksgiving meal. I still had energy enough. I wish I could have went to work, but I took off already that day. I felt like all this crazy, ridiculous, supernatural kind of feeling and energy, and it kind of scared me. Definitely I stopped coughing. I will tell you, I definitely stopped coughing. But it scared me because it was too good. So I was like, okay, won't be taking that anymore. Really, the effect of that pill, I'm thinking in any person who's prone to addiction, that would be it. And I could see how just one pill would do it. So I didn't take any more of those because it scared the shit out of me. But if your patient is suffering greatly and nothing has worked, that did work. I never coughed. Honestly, I didn't cough again. It was ridiculous. So remember, this is a very strong opioid, Vicodin, okay? Codeine is not as strong, probably wouldn't have suppressed the cough as much, but codeine is another type of antitussive. And then you have your Tessalon pearls. And then don't forget the common thing, which is Robitussin. But it won't be called Robitussin because remember, the test is always going to be based on generic drugs. So it's dextromethorphan. Yeah, I know. It's a little bit much for the mouth. Dextromethorphan. That's Robitussin. Sure is. Okay, so that sounds like a mouthful, but that's what it is. It is also the same medicine that's in Dayquil or NyQuil to suppress the cough, and it works well. I always say anybody with a cold or cough, NyQuil is wonderful. Your expectorants is just the opposite. It wants to have, when the patient takes an expectorant, the goal is to have them cough up whatever it is down there and get it out. Okay, so this would be your guaifenesin. I'm going to write that on the board because I'm positive you ain't never heard of that either. But I promise you, when you start working as a nurse, you will give that to every single patient that has a respiratory condition. Guaifenesin. Yeah, crazy, right? So guaifenesin is just a little pill that helps them make a productive cough, beneficial for them to get it out. Some people call it Mucinex. This is guaifenesin, the generic name for it, okay? That is an expectorant. It's going to help you cough it up, okay? Mucolytics, which is right here, is basically the same type of concept as the expectorant. And an example of a mucolytic is acetylcysteine. You know, that's also the antidote if you have what? Acetaminophen toxicity or overdose. So if someone overdosed on Tylenol, this would be the antidote. But as it stands, it's also a mucolytic. And the other name for it is mucomist. Okay, so there you go. This is all for your coughs and your colds and the different things that you have going on. Your antihistamines. Your antihistamines are for allergies, allergic rhinitis. So if I left this on the board, pneumonia, flu, we already did the cold, which is rhinitis. If I put with this word rhinitis, allergic rhinitis, now I've turned it into your hay fever, your seasonal allergies. As you know, those are treated well with antihistamines. So if you turn the page, you will see antihistamines. And one of the things I want to remind you about antihistamines, put it across the top of the page, all have some type of drowsiness. All antihistamines cause a little bit of drowsiness. Some more than others. And I will tell you that the antihistamine that causes the most drowsiness, you already know it. It's Benadryl, which is your diphenhydramine. In fact, when you look at medications like Tylenol PM or Advil PM, all they did was take Advil or Tylenol and add Benadryl to it to help you sleep. So if your patient hasn't had any sleep and they have allergic rhinitis, Benadryl would be lovely. But most of us have allergies and got to get to work. So you must really remind the patient that it might be better to take their antihistamine right before bed so that they wake up and still have a nice effect of it. Some brand names that you already know, Zyrtec, Claritin, Alivert, Allegra, those are all your antihistamines. The Zyrtec is cetirizine, and of course you do have a handout for that. Your Claritin is loratadine, and yes, you did have to know that. Your patient who is on Allegra is fexofenadine, okay, so that's on your handout. So you know, you got to know those names, all right? Now let's move on to another respiratory condition called mononucleosis. There are many of you who had mono in this class. There is There is a big difference between mono and a regular streptococcal sore throat or viral sore throat. With mono, infectious mononucleosis, this is called the kissing disease, and many people that have it are between the ages of 15 and 25. So if you look at it, you're between 15 and 25, usually teenager, college kids. It is severe. It's a severe sore throat. Most of the patients keep thinking they have strep throat, and they don't. But they're going to keep telling you they do because it's so severe and nothing makes it better, right? Nothing you do makes this better. So the patient has a severe sore throat. You already know they have a headache. Yes, they're going to have a fever. Their tonsils are enlarged. They're exhausted. And when you see on your sheet on the left-hand side, fatigue, no. Exhausted, which means they won't go to school, nor should they, and it means they're going to miss work. Now, that's where, you know, if the kid is in college, you might have to do some FMLA paperwork or whatever, because they will flunk out with this condition, okay? We've talked to many students that missed the whole entire semester, because all of this crap is going to last about 8 to 12 weeks. Not to mention, they're going to have swollen lymph nodes. Remember what the word is for swollen lymph nodes? It's going to be called lymphadenopathy. Enlarged or swollen lymph nodes, lymphadenopathy. This is really serious stuff because it can also lead to an enlarged spleen. So there you are with your patient's left upper quadrant, and they have splenomegaly, which means enlarged spleen, and they have no appetite. How bad is the no appetite? You have such a sore throat you couldn't swallow if you wanted to. You have no appetite. You don't care if you ever eat. My cousin went from a size 24 to a size 5'6" after mono. Now she thanks God for mono because it made her lose all that weight, and she never gained the weight back. But that's because you don't eat and all you do is sleep. So this is very serious. What is this? What is caused by? It's caused by Epstein-Barr virus. Highlight that. It's on your paper. It's called the kissing disease because it's transmitted through saliva. You would think it was droplet precautions. It's not. It's actually standard precautions, because we always say unless you're going to kiss your patient, which is a whole nother lecture, you don't have to worry about it. Now, how do we diagnose it? Make sure you know on this page it says monospot. This is a blood test, believe it or not. This patient needs a blood test. How do we treat it? Rest. We give them throat lozenges. It's going to be called this on any test you take. Throat lozenges are going to be called troches. So it's kind of weird, but you got to write that down because it's not like you would know that. And you just tell them to rest. Take their NSAIDs or Tylenol, either ibuprofen or Tylenol for the sore throat. It is self-limiting. Please highlight that. It doesn't need antibiotics. It doesn't need anything. It's self-limiting. I would make sure you knew that. Okay? So that is mono. Now, we have 2 more to cover. I'm not sure how much time we have, but I think I'm going to try to get through the next 2. So we might go to 30 minutes on this one instead. The next one is strep throat. Now, this one is very important, and I would imagine everybody has it. Your next page is throat cultures. You can write all of this information on that page that says throat cultures. What I want you to write down on that page is streptococcal pharyngitis. Streptococcal pharyngitis. So you'll see me write it. Streptococcal pharyngitis. Now, you're also going to write on that same page scarlet fever, rheumatic heart disease, and glomerulonephritis, all on the throat culture page, because every single one of these conditions requires a throat culture. Now, streptococcal pharyngitis, you already get it. It's a sore throat. It hurts. It's bad. It's not going to go away without antibiotics. What kind of antibiotics? Amoxicillin. It's on the next page. Don't turn. So streptococcal pharyngitis, got to be treated. Throat culture is mandatory. Scarlet fever is a little confusing. Now both of these are droplet precautions, but scarlet fever is actually a skin manifestation of strep throat. You still need a throat culture, but it's a skin rash. It's a sandpaper type rash all over the body, including in the mouth, including in the groin, including between fingers and toes, the trunk, the ears, the mouth. The mouth. Remember I said the mouth. Scarlet fever, sandpaper type rash. It's a skin manifestation of strep throat. The child's throat may not hurt yet. This might be first, then this. Either way you go, this kid needs amoxicillin. Rheumatic heart disease and glomerulonephritis are two complications of untreated strep. With rheumatic heart, the patient is going to have migrating joint pain and a fever. With glomerulonephritis, they're going to have tea-colored urine. Both are complications of untreated or undertreated strep, which is why we tell you to take your antibiotics until they're gone. Okay, so those are the things that you have to worry about with strep. You always, no matter what kind of sore throat the patient has, you absolutely have to make sure the patient gets a throat culture. The treatment, again, is amoxicillin, and they have to take it till it's all gone. Okay, so that's that.